A very good evening to one and all. Today we will going to see the another endocrine disorder. I will share here screen. All of you mute yourself. Is it visible? My screen?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Now see here. Today we will going to see thyroid disease. Okay. Yesterday what we seen?
Diabetes mellitus.
Diabetes
mellitus.
So today we will going to see thyroid disease. In that, today we will going to see hyperthyroidism. Two are there, hyper and hypo. So hyperthyroidism. Hyper means what? Excessive, isn't it? More secretion of thyroid hormones. Okay. So hyperthyroidism, it is a disorder of thyroid gland. It is a disorder of thyroid gland. Thyroid gland, which type of gland it is? Endocrine gland. Okay. It is endocrine gland. So it is the condition in which excessive production of thyroid hormones. Which hormones? T3 and T4. T3 and T4 by the thyroid gland. Which excessive production of hormone takes place here? T3 and T4. So it leads to thyrotoxicosis. It leads to thyrotoxicosis, where the toxic effects of excess thyroid hormones are observed. Okay, mute yourself. The thyroid gland is an organ where it is located in front of the neck. In front of the neck, and releases hormone that controls metabolism, breathing, heart rate, nervous system, weight, body temperature, and many other functions of the body. Okay, where it is located? In the front of the neck. So when this thyrotoxicosis is there is a protruded of this neck, isn't it? Sometimes if it is more, we have to operate that one, isn't it? So where it is located? In front of the neck. And which type of hormones it releases? T3 and T4. And what are the role of that one? That hormone controls more functions. Which are those main functions? Metabolism, breathing. See, more spacious functions are there, controlled by thyroid gland. Metabolism, breathing, heart rate, controls the nervous system also. Weight, that's why in hyperthyroidism, it loses the weight, and hypo, it increases the weight. Okay, we will see later. Okay, body temperature and many other functions in the body. What happens if the thyroid gland is overactive? The body processes speeds up. All the processes will increases, will takes the speed. And what happens? Nervousness, anxiety, rapid heartbeat, hand tremor, shaking of the hand, okay, excessive sweating, weight loss, and sleep problems are there. Here in the hyperthyroidism, weight loss is there, and hypothyroidism, weight gain is there. Okay, so what happens if it is overactive? This thyroid gland is overactive, secretes excessive production of thyroid hormone, that is the T3 and T4. And because of this, what happens? All the body processes will increases, will takes the speed. All the body processes speeds up, okay, increases. And what happens? The body may experience, we experience the nervousness, anxiety, rapid heartbeat, that is the increase in the heartbeat, hand tremor, that is a shaking of the hand, okay, excessive sweating, weight loss, and sleep problems are there. Many more problems are there. Is that clear to you? Hyperthyroidism. Hyperthyroidism, it is the disorder of thyroid gland. It releases which hormones? T3 and T4, okay. Due to that, more hormone release. What happens? What happens? It controls what? Metabolism. Before that one, we will see it controls our body metabolism, breathing, heart rate, nervous system, weight, body temperature, and many other functions. And due to that overactivity, it causes what? Nervousness, anxiety, rapid heartbeat, increase in the heart rate, heartbeat, and hand tremor, excessive sweating, weight loss, and sleep problems are there. Now, what are the main causes? You know this one, Graves' disease. This is due to this hyperthyroidism. Okay. This Graves' disease, again, we are seeing here, this is autoimmune disorder. Very dangerous, autoimmune disorder. Okay. The most common cause of this hyperthyroidism is Graves' disease. It is autoimmune disorder. Autoimmune disorder means what? It stimulates our antibody stimulates to secrete the thyroid hormone. Too much secretion due to our body own, our antibodies stimulates the thyroid to secrete too much of the hormone, where in the Graves' diseases, and due to that it prones to hyperthyroidism. One of the most common cause is Graves' disease. Okay, Graves' disease means what? It is autoimmune disorder. What is there in this disease? In this disease, our body's own immunity power increases, and that antibodies stimulates the thyroid to secrete too much of the hormone. Which hormones? Thyroid hormones. Which are those? T3 and T4. Excess iodine. Iodine is need to make the T3 and T4. Actually, for what purpose we need iodine? We are eating no sodium chloride salt. Iodinized sodium, isn't it? Iodinized salt. We see in the advertisement, isn't it? For what purpose? For what purpose? To make the T3 and T4. Okay. To synthesize T3 and T4, little amount of iodine we need our body to production for the production of T3 and T4. Now see, again the causes are there. Inflammation of the thyroid gland. If the inflammation of the thyroid gland is there, then also it causes what? Hyperthyroidism. Thyroiditis causes T3, T4 to leak out the gland. T3 and T4 hormones will leak out from that gland. Due to what? Due to inflammation of the thyroid gland. Due to inflammation of the thyroid gland. Now next cause, tumors of the ovaries and testes. See here, this is also one of the cause. Tumors of the ovaries and testes. Okay. Benign tumors of the thyroid or pituitary gland. There are the chances. Benign tumors of thyroid or pituitary gland. If it is there, then also there is a chances to hyperthyroidism. Large amount of tetraiodothyronine. Large amount of tetraiodothyronine through the dietary supplements or medications. Some of the drugs or some of the medications are there. they, due to that, they supply tetraiodothyronine, that is the T4. Triiodothyronine, T3. These are the hormones. Okay. Due to dietary supplements. Due to dietary supplements. If you will eat more, then it secretes large amount of the tetraiodothyronine, that is the T4. Actually, T3 and T4, two hormones are there. Due to that, more amount of T3 and T4, that is due to what happens? Hyperthyroidism. Okay. Triiodothyronine T3, tetraiodothyronine T4. Is that clear to you? So what are the etiology? What are the causes of this one? Graves' disease, excess iodine, inflammation of the thyroid gland, tumors of the ovaries and testes, benign tumors of the thyroid and pituitary gland, and large amount of T4, that is the tetraiodothyronine. Okay. Now symptoms. Many more symptoms are there. Okay, we see an enlarged thyroid gland that we called as a goiter. We can see at the neck region, front of the neck region, isn't it? So an enlarged thyroid gland, that is we called as a goiter. Fatigue or muscle weakness. Muscle weakness is there. Okay. Hand tremors, shaking of the hand is there. Mood swings, changes the mood. Nervousness is there. Anxiety is there. Unnecessary worry, tension, anxiety. Okay. Rapid heartbeat, that is increase in the heart rate. Tachycardia. Skin dryness is also there, one of the symptom. Trouble in sleeping. Okay. Sweating and sudden weight loss. Weight loss is there here. In the hypothyroidism, weight gain is there. Increased frequency of bowel movements. Okay, the frequency is increased to empty the bowel. Okay, light periods or skipping periods. Okay, in women. Increased sensitivity to heat. Increased sensitivity to heat. Maybe sun or some other heat. Okay, fine brittle hairs. Hair will become fine and brittle hair. Okay, so these are the symptoms of the thyroid hyperthyroidism. Which are those one? Goiter, that is the enlarged thyroid gland. Fatigue or muscle weakness, hand tremors, mood swing, changes in the mood, nervousness, anxiety, tension, worry, tachycardia, rapid heartbeat or increase in the heart rate, skin dryness, trouble in the sleeping, sweating, sudden weight loss. Okay. Increase the frequency of the bowel movements, increase the sensitivity to the heat, fine brittle hair, hair loss is there due to that brittle hair. Okay. Diagnosis. Which are those diagnoses? Actually, the physical examination. Okay. Physical examination. First, the doctor will take the history and physical examination. Cholesterol level test, we have to check that one. We will see in detail. T3, T4 resin uptake test. Okay. TSH level, thyroid stimulating hormone level test. Thyroid stimulating hormone level test, TSH. Triglyceride level test. Thyroid scan and uptake. Ultrasound. CT scan, MRI. Too many diagnostic tests are there. We will see one by one. First, we will see the history and physical examination. Okay, so this only reveal common symptoms such as weight loss. Mute yourself, all of you. Something sound is there. Okay, history. Due to by common symptoms, the doctor revealed that one. Due to what? Weight loss, rapid pulse rate, elevated BP, Protruding eyes. In the Graves' disease, we will see these type of symptoms. Protruding eyes means the eyes will come out, bulged eyes, isn't it? That is we called as protruding eyes. Okay, the eyes, the eyeballs will come out like that we feel. Okay, that is called as a protruding eyes, or the enlarged thyroid gland. We can see in the neck region, front of the neck region. Okay, these are all about the history and physical examination. What the doctor will check? First of all, by seeing only, the doctor can understand weight loss, rapid pulse, increased BP, protruding eyes. These are the signs and symptoms. Okay, and enlarged thyroid gland. Cholesterol level test. Cholesterol levels vary with the metabolic rate. Okay, in the hyperthyroidism, cholesterol can be low due to the elevated metabolic rate. The metabolic rate is increasing. That's why the cholesterol level is low. And due to that low cholesterol level, there is a sudden weight loss. Okay. Due to why the obesity is there? Due to deposition of the cholesterol. But what happens here? In this T3, T4 hormone, it speeds up the metabolic rate, and due to that there is a sudden weight loss. So there is a, in the hyperthyroidism, cholesterol level is low cholesterol level. Okay, due to what? Due to increased metabolic rate. Are you getting this all points? This is related to one another. Okay, T3 and T4 resin uptake test. This test measures the quantity of the thyroid hormone. Quantity of the thyroid hormone represents in the blood. How much quantity secretes due to these resin uptake test we can understand. And according to that, we have to give the treatment. The doctor will give the treatment. Triglyceride level test. See here. Triglyceride level varies with the metabolic rate. Okay, varies with the metabolic rate. In the hyperthyroidism, what happens? The triglycerides can be low due to elevated metabolic rate. Here, cholesterol level also it is decreases due to high metabolic rate, and triglyceride level also it decreases. It becomes low due to increased metabolic rate, and that's why there is a sudden weight loss is there. Are you getting all the points? Thyroid scan and uptake. Thyroid scan and uptake. My voice is audible? Am I audible?
Ma'am. Yes, ma'am.
Okay. Are you getting all the points? These are related one another. Okay. Are you getting?
Yes, ma'am.
Yes, ma'am.
Thyroid scan and uptake. Now see here. This allows detecting if the thyroid is overactive. It can also mute yourself. It can also tell if the entire thyroid gland or just a single area of the thyroid gland is causing the overactivity. In this thyroid scan and uptake, what we will see? Hello, mute yourself, all of you. See, listen here. Keep attention. Are you mute or unmute? Isn't it? Thyroid scan and uptake. Here, what we will scan here, because of this scanning, we can understand, we can detect the thyroid gland is overactive, how much it is overactive, a little part or overall entire thyroid gland is affected, that we can understand by scanning. Are you getting? See, this allows detecting the thyroid gland, where the thyroid gland is overactive or what. Okay. It can also tell if the entire thyroid gland or just a single area of the gland is causing overactivity? Are you getting? Thyroid gland, entire thyroid gland is overactive, or a simple single area, little part of the thyroid gland is affecting? How much we can see in the, by testing this, by scanning we can understand, we can determine. Ultrasound, this is also what we measure here, size of the entire thyroid gland. We can measure here the size of the entire thyroid gland. What happens in the hyperthyroidism? The size of the thyroid gland increases. So in this ultrasound, we can measure the entire thyroid gland, how much it is increased. By the naked eye also, means naked eye inside we are not seeing. Neck of the region, the bulged portion we can see with the naked eye, isn't it? So ultrasound, in that we can measure the inside thyroid gland, size of the thyroid gland. Okay, now thyroid stimulating hormone level test, TSH level test. In this, TSH is a hormone produced by hypothalamus. Okay, the stimulates the thyroid gland to produce the thyroid hormone. So here what we are testing here, TSH hormone, how much it is secreting, and because of this it stimulates the thyroid gland, and due to that stimulating of the thyroid gland, this thyroid gland produces T3 and T4 secretions, isn't it? Due to what? Main is TSH. Main is TSH, thyroid stimulating hormones, where it will produce in the hypothalamus. Okay, and because of this thyroid stimulating hormone, it stimulates the thyroid gland, and due to that stimulation of the thyroid gland, it secretes the thyroid hormone. Which type of the hormone? Thyroid hormone, T3 and T4. Okay, are you, and you understand? Now CT scan and MRI. CT scan and MRI. Now see here, a CT scan or MRI scan of the thyroid gland is done if the pituitary tumor is suspected. When we suspect that there is a tumor in the pituitary gland, then we will go further for the test, diagnostic test, that is the CT scan and MRI. As we know, the CT scan and MRI, in this we can take the more photographs of the, more photographs of anyone, isn't it? If it is heart, then we can take the more photographs of the heart. Here, which type of the photographs we will see? Thyroid gland. Okay, so CT scan and magnetic resonance imaging means what? MRI. Here we will take when the doctor will suggest, when there is a suspicion, or what we will suspect, if there is a tumor in the pituitary gland, then obviously the doctor will suggest what? CT scan and resonance MRI. Okay, now these are the diagnostic tests. Okay, which are those one? Where it is? See, history and physical examination, cholesterol level test, T3, T4 resin uptake test, TSH level test, triglyceride level test, thyroid scan and uptake, ultrasound test, CT scan and magnetic resonance imaging MRI. All it is understood, or shall I repeat once again? Shall I repeat or understood?
Yes, ma'am. Repeat once again.
Oh. See once again, history and physical examination. What the doctor will check here? When the patient will, the individual will go there in the hospital, what the physician will check? By seeing only the patient, the individual, what if weight loss is there? Suddenly he conclude, directly not concluded, due to other reasons are there, but the reasons are there. One of the reason is there. Okay, weight loss, rapid pulse rate, increased BP, protruding eyes, bulging of the eyes, or the enlarged thyroid gland. We can see directly by the naked eye how in the neck region, front of the neck region. Okay, cholesterol level test. What we understood by this test, if the cholesterol level, how it is, you see. Once again, I am telling you. Okay, in this the cholesterol is low. Why low? Why low? Because of increase the metabolic rate. Due to this hyperthyroidism, there is more secretion of T3, T4 hormone. For what purpose? The functions is what? It increases the metabolic rate. And due to that metabolic rate, it lowers the cholesterol. And due to that cholesterol level decreases, due to that there is a weight loss. Okay. And also the triglyceride level test, in this also the triglyceride level will become low, and due to that also there is a weight loss. Are you understood why there is weight loss? Okay, so these type of test we are suggesting to that individual. T3 T4 resin uptake test, what we will measure here? The quantity of the thyroid gland, quantity of the thyroid hormone, how much the hormone is secreted by the thyroid gland, exact quantity of that hormone we will measure here. Okay, so we can conclude it how much it is affecting. Okay, triglyceride level test. In this, the triglyceride level varies with the metabolic rate. Actually, more the metabolic rate, okay, so it decreases due to metabolic rate. Okay, in this hyperthyroidism, the triglyceride can be low. Why low? Due to the metabolic rate increases, and due to that the triglyceride level decreases, it becomes low. Okay, if the metabolic rate is low, then what happens? The triglyceride level will increases. It is inversely proportional. Okay. If our metabolic rate is low, what happens? The obesity will develop, isn't it? Isn't it? So here what happens? But in this hyperthyroidism, the metabolic rate is increased, and due to that, the triglyceride level becomes low, inversely proportional. Okay, keep in your mind. Thyroid scan and uptake. Here, by scanning of this thyroid gland, what we can detect, the doctor can detect the thyroid gland is overactive or not. The activity of the thyroid gland we can detect here. Okay. And again, whether the entire thyroid gland is affected or a little or a small area or single area of the gland is affecting, that only we will detect here. Okay, entire thyroid gland is affecting or only a single area or little area, or which area of that thyroid gland is affecting, that we can see here in the thyroid scan. Okay, ultrasound. Here in this test we will measure the size of the entire thyroid gland. What we will measure here? Size of the entire thyroid gland. TSH level test, thyroid stimulating hormone. Where it secrete? It is secreted by the hypothalamus. And what is the role of the TSH? It stimulates the thyroid gland. Once it gets stimulated, it secretes the thyroid hormone. Which thyroid hormone? T3 and T4. Are you getting? Now the next, that is the CT scan and MRI. What is the main function of the CT scan and MRI? We can take more detailed depth images of that organ. Okay, whatever it may be. Here we are taking the thyroid gland pictures. Okay, all the pictures. But when the doctor will suggest, if the individual is susceptible suspect what if there is any tumor in the pituitary gland. If the doctor detects that one, then he will suggest that he do CT scan and MRI so that the more picture will clear. Are you getting all the points now? Are you understood?
Yes, ma'am.
Yes, ma'am.
Okay. Now see here, treatment. Anti-thyroid drugs. Okay. Anti-thyroid drugs. What happens here? It stops the hormone secretion. Which are those two or one or two examples keep in your mind? Propyl thiouracil, carbimazole, and methimazole blocks the production of thyroid gland. The name itself indicates anti-thyroid drugs. Means what? It stops the production of the thyroid hormone. Okay. Radioactive iodine. It destroys the thyroid producing cells by radiation. By radiation. Radioactive iodine, by these type of radiation, it destroys the thyroid producing cells. Okay. Beta blockers. Why beta blockers? Because there is increase in the heart rate, increase in the BP, isn't it? So sympathetic system hypertensive. Okay. It stimulates. So that's why we can suggest the beta blockers. Example, propranolol. It controls the rapid pulse rate, sweating, anxiety, blood pressure. All it will covers by these beta blocker drugs. Okay. Example, propranolol. Surgery lastly. If it is not effective all the treatment, then obviously we have to remove that one by surgery. So partial removal of the thyroid gland, that is called as a partial thyroidectomy. Tomy means what? Cutting. If the small area is affected, remove that part only. That is the partial thyroidectomy. Okay, is common treatment of the hyperthyroidism. Okay, commonly we are doing this one. The goal is to remove the thyroid tissue producing the excessive thyroid hormone. Means which side, which part, which single part is overactive of that thyroid gland, that part only we will remove, not all the gland. Okay, partially we can remove that one. That is called as a partial thyroidectomy. That is the surgery. This is the common treatment in the hyperthyroidism. Okay, so treatment, which type of treatment we will give? Anti-thyroid drugs, which stops the production of or secretion of thyroid hormone. Example, propyl thiouracil. Okay. Radioactive iodine, by radiation, it destroys the thyroid producing cells. Beta blockers for what? To control the rapid pulse rate, sweating, anxiety, and blood pressure. Surgery, partial removal of the thyroid gland, that is called as a thyroidectomy. Now complication. In every disease there is a complication. If we will not treat properly, then what happen? The secondary disease will happen. The secondary disease will cause, means what? Other complexities will form, heart problems. Because of this thyroid hormone, it stimulates, isn't it? So that's why if we not treat, then what will get problem, complications, heart problems like the rapid heart rate, atrial fibrillation, congestive cardiac failure, CCF, congestive cardiac failure, isn't it? Brittle bones. Why brittle bones? Brittle bones causing the osteoporosis. Porosis. Okay, that is the brittle bone. Due to that osteoporosis, the bones will become weak. The bones will become weak. That is called as osteoporosis. Why? Excess thyroid hormone interferes with calcium in the bones. What we need to become a strong bones? We need calcium, isn't it? If there is no calcium, then the bones will become weak. The bones will become brittle and causes the osteoporosis. Okay? Due to what? Due to excess thyroid hormone, they interfere calcium in the bones. What is the main in the bones? Calcium. Due to that calcium, the bones are strong. If there is no calcium, then what happens? So that in the older age, our bones will become brittle or weak, and that's why more prone to the osteoporosis. Okay, is that clear to you? Next one, the eye problems. The Graves' disease, protruded eyes, bulging of the eyes, swelling of the eyes, redness in the eyes, sensitivity to the light, blurring vision or double vision. If the we not treat, if we will not treat, then what happens? We can lose the vision. There will be loss of vision. What are the main eye problems are there? What are the eye problems are there? See, in the Graves' diseases, ophthalmopathy will develop. Means what? In the Graves' disease, what is there? Protruded eyes, which is the main sign in the Graves' disease. Okay, due to hyperthyroidism, due to hypersecretion of T3 and T4, bulging of the eyes, redness of the eyes, swollen eyes, sensitivity to the light, blurred vision, double vision. If we will not treat properly, then what happen? Loss of vision. Loss of vision. Are you getting? Red and solemn skin is also there. This one, red and swollen skin. Okay, skin will become red and swollen one. Okay, thyrotoxic crisis means what? It leads to fever, rapid pulse, even delirium, badbadne. Okay, unnecessary. We will murmur, no, that is chatting, unnecessary. They also will not get what is there, that is the delirium. It is a medical emergency needing to hospitalization of the patient. In this thyrotoxicosis, what is there? It is the medical emergency. We need to hospitalize the individual or patient. This is all about the hyperthyroidism. So we will see the memory points now. Is it visible? Skin is visible.
Yes, ma'am.
Ma'am.
Hyperthyroidism introduction. It is which type of the disorder? It is a thyroid gland disorder. Okay, thyroid gland, it is an endocrine gland. Okay, so it is a disorder of the thyroid gland. Due to what type of the hormone the thyroid gland secretes? Excessive production of T3 and T4. Due to excessive production, due to excessive secretion, there is a hyperthyroidism. Okay, it leads to thyrotoxicosis. It leads to thyrotoxicosis. Keep in your mind. This thyroid gland is an organ where it is located in front of the neck and releases hormone that controls. What are the main role of the T3 and T4? It controls many more functions. Few of them are metabolism. Okay, we see in this one, cholesterol and triglyceride level will become low due to high metabolism, high metabolic rate. So it controls what? Metabolism, breathing, heart rate, nervous system also controlling by these hormones. Okay, weight also, body temperature, and many other functions in the body. The special functions are there, isn't it? When the thyroid gland is overactive when it stimulates more, when it secretes or produces more T3 and T4, then what happens? the body processes speeds up. All the body processes will increase, will take the speed, and the body may experience what it experience: nervousness, anxiety, tension, worry, rapid heartbeat, hand tremor, hand shaking, excessive sweating, weight loss, and sleep problem. Okay. So what are the etiology? Graves diseases, excessive iodine, inflammation of the thyroid gland, tumors of the ovaries and testes, benign tumors of the thyroid and pituitary gland, large amount of T4, that is the tetraiodothyronine. These are the etiology, these are the causes of the hyperthyroidism. Okay. Symptoms. What are the symptoms are there? Goiter, mute yourself, an enlarged thyroid gland, an enlarged thyroid gland. Pranjal Bhosle, mute yourself. Pranjal Bhosle. Symptoms. An enlarged thyroid gland, that is the goiter. Okay. One of the best symptom. Fatigue and muscle weakness. Okay. Due to brittling of the bones. Okay. Muscle weakness is also there. Fatigue is also there. Hand tremor, shaking, mood changes, mood swings, nervousness, anxiety, tension, worry. Okay. Rapid heartbeat, that is the tachycardia. Heart palpitations or irregular heartbeat, arrhythmia, skin dryness, trouble in the sleeping, sweating, and sudden weight loss, increase the frequency of the bowel movement due to high metabolic rate. Okay. Then increase the sensitivity to the heat, light period or skipping of the periods in the ladies, fine brittle hairs. Okay. Sensitivity, increase the sensitivity to the heat. These are the signs and symptoms of these diseases. How we can diagnose? The doctor will take first the history and physical examination. Okay. And physical examination. Cholesterol level. Okay, what we have to check here in the diagnosis, what we have to diagnose? Cholesterol level, triglyceride level, T3, T4 resin uptake test, thyroid stimulating level test, thyroid scan and uptake, ultrasound, CT scan, MRI, all these diagnoses. By using these diagnostic tests, we can confirm, the doctor can confirm the patient, the individual is suffering from this and this. Okay. So that it is easy for the physician to give the safe treatment. So what are the treatment? Anti-thyroid drugs. What it's the main function? It reduces or it stops the production of the thyroid hormone T3, T4. Radioactive iodine. Okay, due to that radiation, what will causes? It stops the secretion of the thyroid hormones from the thyroid gland due to that radiations. Beta blocker drugs, for what purpose? There are the signs and symptoms. Which are those one? Rapid heartbeat, okay, sweating, anxiety. These will cover by these beta blocker drugs. Okay, example propranolol. And lastly, that is the surgery. And what are the complications? Heart problems are there, brittle bones are there, osteoporosis, eye problems, Graves' disease, red and swollen skin, thyrotoxic crisis. These are all about the thyroid gland, sorry, hyperthyroidism. Okay, are you understood all this one? Are you understand all of you?
Yes, ma'am.
So shall we stop here only? Shall we stop here only?
Yes, ma'am.
Yes, ma'am.
We will
Yes,
end.
ma'am.
Good night, all of you. And one thing I want to tell you, one thing, listen here, all of you not joined this one, the school. Some of the students, they are not joining. I given you the ID and password, isn't it? So join that one, see the PDF, see the, if you not attend the lecture, then I uploaded there also the lectures and all the things. Okay. So you can, again, you can listen the lecture. PDF is there. Okay. Memory points are also there. Okay. Memory points means only the PPTs are there. There I can't upload. So that's why memory points I given the heading. Okay. Not you can't see the PPTs. So whatever there in the PPTs, I uploaded like that only in the PDF. Okay. So attend that one, join that one by enrolling your this mail ID and your password. Okay.